Let's start with the other study. Let's talk about the other study. It said that some GLP-1 drugs, but not all, may be effective in treating alcohol use disorder.
Right, correct. So this was a very large study that was done out of Sweden, 220,000 individuals with a prior diagnosis of alcohol use disorder. And what the study looked at was these GLP-1 drugs like semaglutide, the active ingredient in Ozempic, and liraglutide, which is a similar drug to semaglutide. And what they found was that semaglutide showed a 36% decrease in alcohol-related hospitalizations in individuals with alcohol use disorder. And liraglutide showed a 28% decrease in alcohol-related hospitalizations. Now, what's really fascinating about this is that these GLP drugs appear to outperform other drugs that already have FDA approval and that we use every day in addiction medicine for alcohol use disorder. But again, this was just an observational study. No direct comparisons were made, so we need to do a little bit more research, some clinical trials before we can draw any concrete conclusions.
Wow. And Dr. Sun, it seems like we're learning about a new application for these drugs every week.
It does. And I'm speaking to a lot of scientists, endocrinologists, obesity medicine physicians about the hopes about this medication and what it can mean in the future. And it's remarkable. We're seeing results in terms of benefiting heart failure, reducing the risk of heart disease, reducing the risk of stroke, even some reports about reducing the risk of dementia. When it comes down to it, these medications are mimicking a hormone, and what we're finding out is that that hormone affects more than just obesity as well as diabetes. It also leads to these other results, and what I'm hearing is that we'll likely hear more results in terms of the benefits of these medications, which we can remain hopeful for, but we want to remain critical about the possible risks.
Wow. It's just amazing. It's amazing because this is like George said, it's like, and the viewers feels the same way. It's like almost every week. And thank you for explaining the reason behind that.
Of course.
And you guys work together?
In the emergency room.
That's right.
I'll see you soon.